There is no way you'll be pregnant as a woman without doing this important 3 tests. In short, as a pregnant woman and you're going for antenatal in your center, if they are not doing these 3 things I am going to mention in this very video, please leave that center, leave that maternity and go to another place, because that place is not meant for you. I have seen a lot of pregnant women dying in pregnancy, some dying in labor, some dying immediately after delivery because of not doing these 3 basic tests. And it is very, very annoying. Instead of celebrating that the woman has given birth, the woman is now having complications, the woman is now having issues. This is why this video is very, very important. So if you're a man and your woman is pregnant, please ensure that for every time that she goes for antenatal, that she has done these 3 things. For every time that she has gone for antenatal, make sure that in that pregnancy that she must have done these 3 tests based on when it is recommended, as I am going to say it in this very video. Number 1 test that every woman must do when she is pregnant is to check her blood pressure. Please, your blood pressure is very, very important as a pregnant woman, because this can actually tell whether there is hypertension in pregnancy. Hypertension in pregnancy itself is a killer. It's a killer. It can cause anything in pregnancy. It can affect the baby. It can cause the baby to die. It can cause the woman to have stroke. It can cause the woman to have convulsion. It can cause the woman to have kidney failure. It can cause the woman to have heart failure. It can cause the woman to bleed and die in the process of giving birth. This is why blood pressure check is important. I have seen a lot of women dying because of this. And some pregnant women, when they go for antenatal, they will not even bother to check their blood pressure. If you are going for antenatal care and that's your center, they've not checked your blood pressure at least once in a month, please leave that center and go to another place. Number 2 is urinalysis, urine tests. Urine test, just as you have checking of your blood pressure, is very, very important in pregnancy. Any center that you have gone to as a pregnant woman and they've not checked your urine to tell you whether there is protein in your urine, you should be able to ask as a pregnant woman. Ask that person that have done the test for you, ma or sir, is there any protein in my urine? If there is anything they are finding in your urine, especially protein in your urine, that means that there is likely a problem that needs to be solved or that needs to be monitored. That is why it is important, especially if you are pregnant, at least once in a month as a pregnant woman, you should do urine test called urinalysis to check whether there is protein in your urine. It is very, very important. It is very, very important. The last one is the scan, abdominopelvic scan itself. Now, this scan is part of the test that you do to check whether you are actually pregnant. This one should actually be done at the first stage of pregnancy, especially within the first trimester, that is within the first 13 weeks of the pregnancy. If possible, you should be done within the first 6 weeks, that is at the first 6 weeks of pregnancy, after missing your period. First 6 weeks, you should do it. That will actually confirm whether you are pregnant. Missing your period does not actually mean that you are pregnant. It gives an insight of pregnancy. But when you have done this abdominopelvic scan, if you do this scan, that will now confirm whether there is actually a living or viable baby in your womb. That will tell us. That's number 1. Then after you have done that scan, you also have to follow it up as you're going for your antenatal. There are other times you are going to also be requested to do scan, and you must ensure that you do this scan, because this will tell the position of the baby eventually and the position of your placenta, or whether your placenta is affecting the womb so much that we may need to prepare for giving you blood inside that your delivery, or whether there will be need for you to go cesarean section, as case may be. These are the things that you need to do as a pregnant woman. Please help me to share the video so I can get to as many people as much as possible. Thank you so much.